Well, hi, everyone. This feels like a family reunion after many years. I didn't see you last night, so hi, everyone. I see you. I do want to give a little bit of context, though, of who I am for all the fresh faces. And also, this is my first time in the forest community speaking on behalf of my government role. So not something I've engaged with anyone in this room on, which is very exciting. So today we're going to be going through why I believe fair is in the eye of the beholder. And so starting off kind of a little bit of context here. So I've worked in open data for about 15 years now. It started in microbiology. I was too impatient, too extrovert for the lab, moved to science publishing, moved over in 2017 to California Digital Library, where I was engaging mostly with the forest community here through things like Dryad, Make Data Count, co-founding the Force 11 data publishing ethics working group with Aracha, and just working on all the things in this community. And in 2022, I moved over, we invoked an IPA. So I don't know if folks know what that is, but in America, there is a act called the Intergovernmental Personnel Act, which means that because I was at a state institution, University of California, we could detail me into the federal government. And so I am on a detail at the Administration for Children and Families, who brought me in to develop their open data policy and their infrastructure for data for the agency. And this background is relevant because I want to walk through quickly what I believe were the drivers in the open data movement in those roles and why it's been humbling for the experience at the agency broadening that scope. So in the lab, genome sequencing, infectious disease isolates, I was introduced to open data. It was not exciting. It was truly just what you do. We deposited our sequences from the microarrays. We reused them from NIH repositories. It was a requirement. It was common practice. It was not monumental. And the perspective was siloed in that because that was in the microarray world. And once I moved over to a dry lab to do pharmacogenomics, data was not framed in that way. There we go. In 2013 at PLOS, the launch of the open data policy felt monumental. The framing was inspiring, instilling confidence in science for the sake of replication, transparency, true open science. Some of you in this room were a part of this. Some of you are there now. It was very exciting. But as we checked through the papers, there was little fluidity in the policy for it. And we weren't considering what the type of study was and what valuable data for that study would be, just is there raw data. And this was partially due to resourcing the sheer number of papers flowing through the system, but it was also a sign of the times. The FAIR movement was not yet popularized, and the goals for open data was quantity over quality of what the data that was outputting was. And one big misconception I had during this period of time was I thought sensitive data infrastructure existed at institutions everywhere. And I was advising the PLOS One staff to push back on authors and say that your institution can hold the data for data upon request, which was so out of touch with reality of what institutions around the world have had. But the success of this time period was around the culture change and really driving that forward as opposed to the value of the data. At CDL, though, we focused on quality. We focused on meeting researchers and their workflows, building not for specific institutions, but researchers writ large, infusing best practices like metadata, and data curation into workflows and things that wouldn't burden researchers further. And one thing I felt really strongly about in this time was about the verbiage and shifting people from saying that when you put data in a repository, you're just depositing, to calling it data publishing, but trying to draw parallels to academic publishing. But what I realize now is that siloed the work even further, because that siloed it to open data in scholarly communications and not open data writ large. And what remains true and prominent from this time period of work is the emphasis on quality and understanding how data are reused so we can accordingly assess valuable data and not waste resources. Okay, so 2022, IPA joined the Division of Data and Improvement at the Office of Planning, Research, and Evaluation at the Administration for Children and Families. And what I didn't know prior to joining was they actually had been long in motion around open data, had not engaged. And at this point, you're still saying, what is ACF? So I will tell you. Okay, maybe you haven't engaged with them, but you know the programs that ACF administers. Health and Human Services, big agency, I think maybe the biggest agency in government. Under it, operating divisions, NIH, FDA, CDC, Health. Human Services, Administration for Children and Families. And so we are made up of program offices that administer social service programs to states, tribes, territories, localities, community organizations, for example, TANF, foster care, early child care, refugee resettlement, human trafficking monitoring, and tribal support. And so all of the programs that are essential to children and family well-being. And because of this, ACF has data on more than 60 human services programs. Before I show that date. So I said they were doing this before it was cool. 1988. We often talk about gene sequencing and that kind of kicking this off. In 1988, ACF launched NDCAN. NDCAN is a data repository hosted at Cornell that was built and continues to sustain for the purposes of secondary analyses of data. It has great metadata. There are DOIs, 1988. And the reason that it's unique is also that states and local agencies are accessing the data from it to analyze their programs and link it with research data. And so some of the data that's here are the national studies on child abuse and neglect, children well-being, youth in transition, all of those large-scale studies. Again, 1988, I'm not going to keep harping on that, but a long time ago. Also at OPRE, the Office of Planning, Research, and Evaluation, where I am, we've long supported granting opportunities for secondary analysis, so reusing publicly available ACF data to address research questions and outcomes of the programs administered by ACF. So here are some screen grabs of some of those grants. And some of you in this room, I looked at the attendee list, are at institutions that received these awards and had researchers working on them. More recently, in 2019, the Child and Family Data Archive was created at ICPSR for research surveys administrative programs. And through that contract, we publish over 350 data sets on young children, the families, and the programs that serve them. Repositories. Moving over into policy. In 2021, the ACF evaluation policy was updated to expand for more equity focus, but it was announced in 2012, published in the Federal Registrar in 2014. And it's, let me take a step back here. Evaluation, evidence, what am I saying by this? So data are not inherently evidence. Data are built to become evidence. The Evidence Act of 2018 that you may have heard of was put into place to open up administrative data. That was under the same values of our open science values, opening up the data, deriving evidence-based policy, making change. So agencies have been dedicated to opening up and reusing data to drive this change for a while. So why data to evidence? Well, open data is essential in keeping up the values of the ACF evaluation policy because it's centered around trust and transparency in the programs. So if we want to use evidence to prove and better the programs, you need trustworthy and integral data from trusted individuals. So data to evidence evaluation. We're going to come back to that. So just remember. But it was important to me to talk about these things before mentioning the 2021 public access memo. And while mandates like that are very important in this nation and elsewhere, it's not entirely new. And that's not to say I should disclose, I am on the OSTP subcommittee for open science, folks in this room. It is great. We are implementing it. It is essential for the future of open science in this nation. But again, this isn't entirely new to agencies that are stewards themselves of data and not just seen as research funders that have valuable data corpusy. And so also excitingly, ACF is announcing our inaugural data strategy. And part of that is our first ever open data plan, which the Evidence Act required, but an open data policy across the entire agency as well. We will come back to that as well. Okay, so fair is in the eye of the beholder. We'll get there. But I want to talk through what fair data can look like in practice when we're not talking about it for principles and checklists. And the first example, I have 3, is about making the most of mandates. So mandates, absolutely, drivers for open data. But I'm proud of ACF for taking a mandate and then considering upstream how to maximize that accessibility and reuse by thinking about actually at the study level. So in 1980, the Refugee Act was passed in America, and that established from that legislature the Office of Refugee Resettlement at ACF. And part of that mandate is that ORR, Office of Refugee Resettlement, has to report annually on the state of the refugee population in America. In 2016, ORR and my office undertook a redesign effort, and in doing so, made a commitment to always publicly post these survey data. So when they were doing this, they looked at data quality and they rebuilt the survey to ask about multiple dimensions of refugee well-being rather than just self-sufficiency. So new questions were around experiences before arrival, employment and income, well-being and reception, social connections, healthcare services. Why does that matter? Because external researchers are now interested in this survey, and we've now broadened the use and how much effort is going into this. So now, 2016 to 2021, all of these files are available at ICPSR. But what I really want to harp on for accessibility here is that it is the only nationally representative survey in America that's conducted in over 20 languages, and the languages are determined by the incoming refugee population that year. So when we're thinking about data quality, we are actually capturing the highest level data because it is accessible to who the survey recipients are. And then in the reuse, it's both trusted and more accessible by those. Last point on this one, because it's very cool, is that the public use files at ICPSR, they have individual and household level data for what you could imagine could be sensitive, but the way that it was done has been so great. So let's also look at what happens when open data is beyond the researcher audience, or specifically when folks who are recipients of the data are not necessarily data savvy and don't need those raw files. So if we look at accessibility in terms of who may benefit from the data, it begs us to question what the right level or format of the data may be. For example, the most important users of that data may be grant recipients like a state, members of Congress, the White House, state governments, students, members of the media. So a perfect example of this, LIHEAP is the low income household energy assistance. Yeah, you heard me practice program. Thank you. And they went out and asked their grant recipients, who are states, tribes, and territories, who administer that funds then to the recipients, what is it that you need to do better outreach to the communities affected by the extreme heat and the changing climate? And what they learned when they talked to tribes, territories, states, they said, what's important to you? What data needs to be shared? They said, we don't have the systems to work with data. So we just need a visual, accessible way for us to get that if we don't have our own system. And so while building this deck, I was interviewing folks across the agency and a director there so that when she was the head of human services at the state of Missouri, this was so helpful because she didn't have to then invest that resources, knew she could trust the data, push one button, be able to run it, and have a better sense of where their outreach needed to be. Further, the LIHEAP extreme heat dashboards were created because, as we know, hotter temperatures have led to extreme heat across the nation. And these dashboards were developed to be able to better respond to disasters and make sure that people were aware of their planning. And so they wanted to think about high quality, accessible, and timely data for partners and policymakers to be able to drive those insights. And so the dashboard looks at the progression of extreme heat over time, health impacts, hospitalizations, visualizations about how to alleviate, especially for vulnerable populations like older adults, young children, and people with disabilities. And so on this dashboard, recipients, humans living in affected areas, people that are building the better response teams have that data at the right level that they need. And so when we talk about accessibility, I felt like a lot in this community we just talk about, is the file format open? Is that accessible? But really there's this thinking about what is the level of data? And by having a dashboard, 2014 me would say, no, we need the raw data. This dashboard isn't useful. But actually it is exactly what was able to get people to be able to respond and act with the data in a way that could help them with preparedness that they understand. The last example is about the goal for open data. If we want to maximize reuse, what are the skills that are necessary for people to have to use the data? So FAIR outlines the principles for it, but even the most well-documented, clean and tidy data, it requires users are resourced and skilled and fluent to be working with that data. And so ACF has an excellent example of piloting what it looks like to enhance data reuse by investing in the data users and seeing that downstream effect. So the Temporary Assistance for Needy Families, TANF program, is run out of ACF. It gives funds to the states administer to their populations. And ACF initiated this collaborative project called the TANF Data Collaborative across 8 states, where they were saying, okay, all these states have access to their TANF data, and they're doing routine reporting back to the Fed what they need, but they weren't doing analyses on how to make the program better. And so they needed to do a technical intervention with assistance trainings and skill development. What they did was they brought together project teams at the state level that was data people and policy people to make sure that the questions for the analyses were being defined well and that they would be useful in interpreting answers. They found that if they were going to be putting this much effort into the analyses, it needs to be as good as possible. And it required basic training in data fluency so the policy people and the data people could actually communicate with each other. So that doesn't mean that the policy people needed to be able to work in R, but at least be able to communicate about more technical data stuff together. So like I said, this was piloted across 8 states, but the first example I want to show is Colorado. They were interested in seeing if targeted payments would address barriers to employment better. So would a payment for something targeted have better long-term outcomes for that? So they piloted saying, here's cash assistance benefits, but you could also get a special payment for a particular thing, transportation or clothing or other barriers to employment. And then the team learned about an approach called the propensity score matching so that they could answer the question in a more rigorous way, not just compare the outcomes, who received a payment, who didn't. And because of it, they are now able to expand the support of those targeted payments across the state of Colorado. In California, I know I could have chosen other examples, but we have the best flag. California was interested in the cost of living, which anyone living here is probably nodding vigorously at that. So they thought we have to look geographically. What they had been calling a success for the TANF program in California may not actually be qualitative success if you're not looking at what that looks like in light of cost of living differences. So they investigated the role of place and outcomes in the state, and they created an analytical file that linked TANF and wage data, and we're able to do that proper analysis and run fixed effect models that had never happened before. So why is this so big? The open data was there. They had access to the data. That is not what changed. What changed was the data fluency. So depending on the fluency of the analysts, the data people, do they understand how the policy works? And for the policy people, do they understand what the data mean and what data can and can't say? That shaped the amount of translation necessary. And it gave an effectiveness of these analyses to actually optimize these social programs. And so many of the states, they're still working and communicating in this way. So by upskilling in data fluency, they can choose good data quality because they now have that skill and ask the right question. And I get it. This approach is not scalable for the nation for everything that we do, but I think it's really great at highlighting the human context and the role of data fluency in this when we are talking about reusable data. Before going into like the real thesis I'm trying to get to, I do want to show a little bit about what our agency is also doing internally for this. The first is secure infrastructure. This one is near and dear to my heart. It's why I was brought into the agency. It's what I said was always bugging me earlier in the open data career. Our agency is investing in the resource to actually have the data be in a secure environment with the right data science, data analytics tools, capacities that are there. And not only for internal analysts, but for external researchers to be able to apply for access, come in, work in that environment, not even on government laptop, but in a secure way, and be able to bring in other human services data, other health data, publicly available data, whatever that may be, but you now have that environment. And there are tons of other agencies that are working on this, and we are doing skill, experience sharing, blinking on the word. We're all talking about what's worked and what's not worked, and trying to collaborate and not try and all rebuild that together. Agency partnerships, building on that, we are working with other agencies and the infrastructure they have. So it turns out we don't all work in silo. We're using the census to also put data into their infrastructure as well. Upskilling, so I was just talking about data fluency, but not just with raw data skills, but also we're investing in data visualization skills and other ways to do more accessible products. Speaking of data products, a lot of investment in creating relevant data products that are accessible to diverse communities, and especially the communities that ACF serves. And so a lot of that is thinking about the investments made into aggregate data release, especially when aggregate data is more accessible for an audience, in addition to raw data, or when raw data cannot be shared because of sensitive reasons. And the last is policy. So I mentioned that we're launching our inaugural data strategy with open data as a part of that. So Evidence Act, administrative data, open it up. 2021 public access memo, research data, open it up. We're like, data, everything from the agency. What's the plan for it? Open it up. So that is a big investment in the agency right now. But a policy I do want to highlight is how to make what I believe a very fair way to implement a new data policy, which is the HHS tribal data sharing policy. So again, operating divisions, a part of Health and Human Services. So for a little bit of context, American Indians and Alaskan Natives have worse health outcomes than the general US population. So there are tribal epidemiological centers that are funded out of HHS that are studying how to better respond tribal health needs. They need access to that data, and it's largely been a legal conversation around how they can do that to do their jobs well. But tribes have concerns over data sovereignty and privacy. So, great way of doing this. In January, HHS put out a Dear Tribes letter, and since then has consulted with each tribe, taking in their considerations, letters of support, privacy, working directly with those communities so that now, as they start to put together that policy across our operating divisions, and I should note, ACF has the Administration for Native Americans, so ACF big role in this one. They're drafting a policy that then they can go back, consult, iterate back on all of this feedback, and actually release a data sharing policy that had the folks in mind that it affects the most and have their trust and make sure that the data that is going to be open and accessible just all around has that trust and safety and privacy concerns being accounted for. Okay, so this is what we're all building to. What is it that I want you to take away from the time I've had at the agency? And that is fair is in the eye of the beholder, because fair is beyond what we approach it in the scholarly communications world, because open data is much beyond research. So regardless of the data type, every data we can think of, there are key infrastructures for open data: technical infrastructure, data fluency, best practices, reusable open source code so it can run things we all work on in this room. And the list goes on for things that are required for successful open data implementations across the board. But if we focus on this strictly as scholarly communications, we're not really keeping accessibility in mind. The core goals and questions that we have about open data are data being reused to drive change. So all of these conversations on evidence, research, administrative priorities between all of my last jobs in government now, every swim lane of conversation happening at the academies right now, they're all the exact same conversation, but they're just being framed a little bit differently. And they're all the same because open data is a required feed to meet the needs for evidence building, evaluation, policy, advancement of everything. But it's a component, and it's a critical component. So if we consider open data as just a research topic, we start to silo that a bit. So I recently got into gardening adjacent, meaning I don't actually do it, but my my gardening guru, Maria, told me this morning that a good analogy for this is if open data is the root for the system, it has to be healthy. It can't be blocked. It can't be segmented. Otherwise, it's not set up to thrive, and the rest of the plant, or in this case, the ecosystem, can't thrive in fruit. So why would we segment or silo what is this core thing that's so important? So if our theory of improving society is based just on academic research, it's incomplete. Because what does findable mean beyond research? What does accessible mean to diverse users? And what are we actually doing to make sure that the data are being used and not just out there? When we refer to open data as a public good, when we refer to it as a public good, we are not speaking directly and only about researchers. Researchers are creating things, advancing research. Data are also created by people and consumed by administrative and corporate and commercial and enterprises all across the board. We are walking data. We are creating data every moment. And while I've focused here on the administrative and government-funded research at ACF, think about commercial data sets that have been absolutely pivotal in advancing society, like city planning using Airbnb or census using the Visa data set. So public reuse of data to advance society requires us to think about life beyond research data and data in everything and expanding that scope of the ecosystem. And not only as a public good, but data for public good. So back to that thing I was trying to talk about. Data, not inherently evidence. Data contribute to evidence building. And to do so, data need to be timely and topically relevant. They need to be relational. They need to be trusted. So if we are getting to this world where we're using evidence in everyday regular routines, we have to consider then that open data is this building block for evidence. And maybe if we reframe this all as a building block towards evidence to better the world, society, for public good, maybe that gives us a little bit more of a tangible roadmap when we're talking about data for the public good. And this was a quote from my deputy secretary that she thought was really apt for this, which I totally agree, which is how many people it takes to be able to answer these questions. Speaking of questions, last week at a meeting in DC, Nick Hart at the Data Foundation said, we don't start with the data, we start with the questions. And this isn't just about research questions, but questions about who the data are for and how they will be used. So what can we all do today in this room to ensure that we are promoting fair data? Well, we could think upstream and not just at the end of the data, which I know we've talked about, but I'm saying think about who the data may be for. Thinking through these questions and thinking about protecting privacy, ethics, integrity always underlying these principles, of course. And trying to pick a title for this deck, I was talking with the witty Carly Strasser, who deserves credit for the naming, but as I was working through the talk, what I realized is that it's exactly the takeaway that I want to impart. Nothing inherently makes a data set fair. No process, not even AI, could make a data set fair because it's about understanding these questions. Fair data are only fair if the reusers are able to effectively use that data. So if we want to build for a truly inclusive, more interoperable landscape where public, private, academic sectors are working together, which we all need to, including private, including all of it, we have to be collaborating with a more successful infrastructure for that. I was discussing this talk before putting it together with John Shaki, and he described this to me as vertical interoperability. So it's less about making sure that we are working, that every repository is interoperable, but what does that interoperability and accessibility look like vertically? So for this type of audience, for this type of analysis. So I tried playing around with one of those AI image generators, but I just like absolutely don't understand them at all. And I put in data as a public good as the prompt, and it returned some absolutely psychedelic, outrageous images. And I feel like that in itself is the perfect illustration of the fact that we've yet to actually achieve this vision of data as a public good for public good. So maybe when I version this talk in some years, we'll get to a point where we have a good visual exemplar here. But my hope in walking through these perspectives allows for a diverse perspective on open, fair data, because the government agencies are not just funders, but we're practitioners and stewards of high value data. And in this community, there are many institutions, and in my home institution capacity, I know that I have believed that institutions and academic research are the center of gravity for change, and they do make change. And there's lots of communal goals for open data and what's to be accomplished, but there's also differences to be accounted for. And this morning, a colleague posted a paper that the GSA Office of Evaluation Behavioral Science Fellows put together a paper about how academics and government can work together. And I would put up the slide, but I had to get my slides reviewed and I can't change them. So I can send around the paper if people are interested. But the big thing that they highlighted that was difficult was around data sharing, which is so interesting, of all of the data scaling and analysis there. So a major way that we could derive effective change and build for evidence-based policies, science, society, is if we build for true public access and actually sticking to public being the true term. So I would suggest that if we reframe our goals for open data as not open data just for open or open for public reuse, but as an essential component and a building block to evidence building, maybe we can model our priorities from there. Thank you.